Welcome to Friday's edition of COVID-19. There has been a notable surge in the number of young COVID-19 patients here in the country and elsewhere around the world. Accordingly, today we delve into this phenomenon with our panelists later on in the program. Here first with the pandemic updates with our Kwon So-ah. So, welcome.
Hi, Sunny.
Right, so I understand Korea's daily tally remains little changed today.
Right, Sunny, just 41 fewer cases compared to the day before, meaning 1,841 as of 12 a.m. And that is a drop in both domestic transmissions as well as imported cases, although just a slight drop, as I said before. Now, if we take a look at our graph, we are seeing infections hovering between 1,400 and over 2,100 in the past week. And for the second straight day, we are at over 1,800. And Korea has so far accumulated 245,158 infections. Now, by region, this Friday, we are seeing no big change in the numbers, but quite a decline here in Ulsan to 20 cases. Meanwhile, in Jeollabuk-do province, beginning this Friday, level 4 social distancing measures will be in effect in the city of Jeonju and Wonju County. Now, with the situation currently seeing little signs of improving, but also no indication of worsening, health officials are in the midst of drawing up social distancing measures, special measures that is, for the upcoming Chuseok holidays. That announcement is slated in the coming days. But it looks like experts are divided on a number of issues, including when it comes to private gatherings over the holidays.
For last year's Chuseok and this year's Lunar New Year holiday, we asked families to refrain from visiting each other altogether. Whether the same measure is needed for this year's Chuseok or whether family gatherings or visits to nursing homes and hospitals should be partially allowed is part of our current discussions.
Right, and of course those discussions have been rendered possible given our current inoculation numbers, So-ah.
Exactly, Sunny. And also because we are now starting to vaccinate people aged 18 to 49 since yesterday, we are expecting 70% of the nation's population to receive at least one dose of COVID-19 vaccine by the Chuseok holiday. Now, currently, that percentage stands at 54%. Now, when at least 90% of seniors and 80% of adults have been fully vaccinated, that's when the government may consider a shift in strategy to live with COVID-19, according to KDCA Commissioner Jung Eun-kyung at an extended briefing on Thursday. Now, staying with vaccines, the World Health Organization is expected to provide some 100 million COVID-19 vaccines from China Sinovac and Sinopharm, through the COVAX facility by the end of next month, according to a report citing WHO document. And that would mark the first time for COVAX to ship Chinese vaccines, and they are mostly expected to head to African countries as well as Asian countries. But not all of these countries are willing to accept these vaccines, also including South Africa here, which said there's not enough information on the effectiveness there. And South Africa, meanwhile, is adding some 12,000 infections in the past day, currently at 2.7 million. Meanwhile, we're seeing that Iran, at 4.8 million cases in total, has surpassed the total caseload of Spain in the past day. And the total number of infections around the globe stands at 215.4 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Medical workers across the globe continue to bear the brunt of COVID-19, with the prolonged pandemic taking both a tremendous physical and psychological toll on them. Now, this plight is particularly pronounced over in the Philippines, and for more on the situation there, I have Melbert Reyes, the head of the Philippine Nurses Association, live on the line. Mr. Reyes, welcome.
Good afternoon, Sunny.
Now, I understand the workload has been unspeakable for nurses there in the wake of the pandemic, and many have had little choice but to resign. Now, how severe, Mr. Reyes, is the exodus of nurses from hospitals in the Philippines?
The COVID-19 pandemic has seriously impacted the work of the nurses as frontliners in fighting the war against COVID-19. That makes their job tough and challenging to the point that it is taking a toll heavily on them, causing them stress, fatigue, exhaustion, burnout, anxiety, depressions, and above all, frustrations and dismay over some benefits promised to our health workers our nurses by the government. As to the number, in the Philippines, especially big hospital, private hospitals in Metro Manila, resignation of nurses is common even before the pandemic for several reasons and a matter of personal choice to work abroad for better opportunities. According to the Private Hospital Association of the Philippines, 40% of their nurses are resigning.
I see. And this is just in Manila then, Mr. Reyes?
Actually, it's across the entire country.
I see. Please tell us a bit about the plight of nurses in the Philippines. I understand one nurse may have to take care of like 15 patients over a span of 12 hours. Is that accurate?
That's correct, Sani. As I've said a while ago, even before the pandemic, resignation of nurses is very common in some hospitals for them to work abroad for better opportunities. And especially with this pandemic going on, despite the deployment cap, many nurses still opt to go and work abroad. Those who are talking and joining protest actions in some hospitals are not only nurses, but other health workers, demanding from the government to give them the benefits that are due them and promised by the government, such as the allowances and compensations.
I see. Mr. Reyes, the medical arena includes doctors and nurses. So why is it that it appears nurses are facing the brutal brunt of the battle against COVID-19 in the Philippines?
We all know that nurses stay at the bedside of patients 24 hours a day. We are all frontliners, no? All medical workers are frontliners, but at the front of the front line is nurses. They stay at the bedside, even if it takes the whole duty, their whole duty. They stay 24 hours a day with the patients suffering from this COVID-19 that led to higher workload taking care of the sickest and most contagious patients. No, wherein our nurses are also suffering from psychological distress, exhaustion, fatigue, and shortage of quality PPE, social exclusion, stigma, discrimination, and all of those that was associated with COVID-19.
I see. Mr. Reyes, amid the lack of essential health workers, how are hospitals in the Philippines coping with the surging number of COVID-19 patients? And how severe is the resurgence there in light of the spread of the Delta variant?
Actually, we are having difficulty given the fact that we have a lot of shortage in our staffing. So the nurses who stay in the hospitals have to dealt with it. No, they have to take workloads now over and above their duties and responsibilities. It's really hard that our nurses really would really need to take most of the jobs now that is being brought to them because of the shortage.
I see. Mr. Reyes, quite recently, Philippine President Rodrigo Duterte called for immediate action by relevant authorities to address the financial woes that you mentioned of healthcare workers. Could you tell us a bit about the efforts being made by the government to address this issue?
Yeah, the Philippine government appealed to the nurses and other healthcare workers not to resign, assuring they will soon receive their special risk allowance and other compensation as early as next week. President Duterte himself gave the Department of Budget and Management at least 10 days to release funds for the distribution of healthcare workers and benefits. The Department of Budget and Management, affiliated with the Department of Health, has already released the necessary funds to supply the necessary compensation and benefits. The Department of Health expressed willingness to listen to the demands and concerns of healthcare workers for not these mass resignations to happen.
I see. All right, Mr. Reyes, thank you for making the time to shed greater light on the plight of healthcare workers there in the Philippines.
Thank you, Ms. Annie. Kamsahamnida.
Right, kamsahamnida. Now, up next, we bring you the regular afternoon briefing on the pandemic situation here in the local front for this Friday. And while we wait for that to start, here is a reminder with regard to inoculations for those aged between 18 and 49. Do remember that online reservations remain open until the 18th of September, so do seek to make a booking for your vaccine if you haven't done so. The briefing's about to start. We'll come back to you afterwards.
I am the head of the National Research Institute for Infectious Diseases, Kwon Junuk. And let us now begin our regular briefing for August 27th. First of all, on the global outbreak of the COVID-19 virus, here are some updates. Globally, the COVID-19 outbreak has been on an upward trend for the past 8 weeks. And right now, we are also seeing a stagnant increase in the number of new infections. However, in US, Israel, as well as Japan, we are continuing to witness increase in the new number of new infections. And for the past 1 week, we have, according to the WHO, we have seen that about 4.56 million new patients were added, and the US in particular has witnessed a 9th consecutive week of the COVID-19 infectious increase, and also centering around the states that have low vaccination rates. They are witnessing an increase in the number of hospitalizations as well. And in Israel, we have seen a major increase in the number of hospitalizations, centering around those aged over the age of 60. They have been seeing an increase in the number of critically ill patients. And our neighbor Japan, they have also witnessed a 9-week increase of the COVID-19, and it is also reporting all-time high daily tally. And globally, amid the COVID-19 spreading at a very fast pace, here in South Korea, we are also seeing very good participation of the public in the social distancing measures and quarantine measures. And we are also having the full-fledged rollout of the COVID-19 vaccines. And our situation here is better relatively than other countries. And compared to other countries, we have seen about 243 cases out of every 1 million people, which is relatively lower than other countries. And as for the fatalities per every 1 million, in all countries, including South Korea, we have seen a major increase. However, here in South Korea, our fatality rate is relatively lower than others around the world. And next, here in South Korea, we also have some updates on the waiver of the isolation for South Korean nationals who have been fully vaccinated and when they return back to the country. And as for the people who are getting vaccinated overseas and returning back to country, we have had the waiver of the isolation, and we are going to change this to those who are subject to those who are vaccinated here in South Korea. And we were also going to have a PCR testing, meaning that after the first day of their return, we will be adding another additional PCR testing for these group of people. And this will be applied for all of the people, inbound travelers, starting from the 30th of August. And originally, we have had the 2 weeks of the vaccination to have the waiver of these isolation. And we believe that if 2 weeks have not passed for these recipients when they go overseas, they could have a risk of COVID-19 infection. However, in order to increase the convenience of these people, we are going to adjust this standard to 2 weeks after being fully inoculated. However, as we mentioned, all of the people who have been inoculated here in South Korea, as for all of the people who are returning from overseas, we are going to add another PCR testing on the first day of their arrival, meaning that we believe that this could help us to monitor and also diagnose those who have been contracted with the Delta variant. And next, on the clinical symptoms trial, we also have some analysis of the research of the study on the side effects of the COVID-19 virus. And we have been cooperating with a number of medical workers here in South Korea, and we have been carrying out in-depth study that is with the COVID-19 side effects. And in the Gyeongbuk region, as for the Daegu city, we have been carrying out online survey and identified their symptoms, the side effects that is, and we have carried out the first survey on the October and the second on this May, and we have about 55.7% of the respondents who number at 177. We have also saw that even after the passing of 12 months after being contracting with the virus, they still witnessed continuing the side effects. And major symptoms were a decrease in memory and decrease in the concentration, and also depression and prolonged fatigue. And in other countries like the UK and Germany, we are also seeing many people who are witnessing such side effects after the passing of 12 months after being contracted with the virus. And this was very similar with the conclusions that we have found here in South Korea as well. And on this specific topic, we will be carrying out a further study and analysis. And also, please take into consideration such side effects that could prolong. And you need to also be encouraged to get the COVID-19 vaccination. And as for the new variant cultivation, we have had about 862 samples being cultivated here in South Korea. And as for the administration of the treatment, the remdesivir has been administered to a total of 13,157 patients here in South Korea. And the regular treatment has been administered to a total of 90 hospitals and to over 11,000 patients here in South Korea. And next, on the COVID-19 vaccination front, we also have had some measures to prevent any administrative errors of the COVID-19 vaccines. And we have also seen that these errors are resulting from some mistakes or misunderstandings of such hospitals. And we have a total of 850 cases of the administration errors of COVID-19 vaccines, which amounts to about 0.002% of the total cases, total inoculations, that is. And we have seen some errors of the period of the injection and also the type of vaccine and so forth. And to this end, the quarantine authorities here in South Korea, we will be intensifying our education and training for the healthcare workers, and in order to also prevent such mistakes being repeated in the future. And we will also going to cooperate with other agencies and also government ministries to also improve any of the environments that also allow such administrative errors, that is, to take place. And we will also monitor this going forward. And last but not least, here is my message to the public. Here in South Korea, the COVID-19 daily tally is still hovering at the 4-digit number. However, last week, compared to the last week, we are seeing a slight decline in the number of daily cases. Nevertheless, it is very important depending on how this situation unfolds going forward. So during the weekend, we ask you to take particular precautions and wear your face mask, and also practice social distancing measures. As mentioned earlier, our inoculation speed is again picking up pace. And also by this week, we have around the world, we have administered over 500 million COVID-19 vaccines globally. And we believe that these inoculations are very important to contain the spread, especially amid the rampant spread of new variants that are emerging. And we are also seeing a very significant trend as for those countries with vaccination rates with over 70%. For instance, Iceland, for example, they continue to witness COVID-19 infections. However, since May, they have witnessed 0 cases of fatalities. And in Uruguay and Denmark, they also have a very low rate of fatality being reported lately. However, in countries that have just surpassed the 50% mark when it comes to inoculation, including the US or the the UK, which have eased the COVID-19 restrictions before reaching the 60% mark for the inoculation rate, they are seeing a rebound in the number of fatalities. As mentioned earlier, the WHO has mentioned that this week our COVID-19 daily tally has peaked, and this means that globally we are seeing more spread of the COVID-19 vaccines. And when we look at this COVID-19 curve globally, this specific wave is the third wave of its kind. And despite the spread, the Delta variant spread, the third wave is very smaller compared to the previous two waves. And the WHO also says that despite the inoculations, each countries need to be very careful and cautious when they decide on any measures of easing COVID-19 restrictions. And likewise, here in South Korea, we will be monitoring these important figures, including how the COVID-19 infections folds out here in Korea. And also going forward, we will be responding to this outbreak in a very cautious manner going forward. And so we ask you once again to comply with the social distancing measures and please stay safe during the weekend. Thank you very much.
Right, there was Kwon Junuk with Friday's afternoon briefing, and I have Soa here back at the desk with a summary of his address. Right, Soa?
Right, Sunny. Kwon mentioned the fast-spreading Delta variant numerous times during the briefing, and he cited that the World Health Organization said that the global increase in infections for the 8th consecutive week has been slowing down lately. Nevertheless, in some countries like the US, Japan, and Israel, even countries with high vaccination rates, the spread is continuing, and that because of the Delta variant factor. With that, Korea is also closely monitoring the situation, although it is not as much affected by the variant like in these other countries, despite having lower vaccination rates than some of these countries abroad. He also mentioned some revisions to vaccinated travelers. So people will have to undergo an additional PCR test upon arrival here in the country in a bid to prevent breakthrough cases. And in many cases, those are asymptomatic patients. Last but not least, again, vigilance over the weekend.
Right, and speaking of the weekend, have a good weekend yourself, Soa.
Thank you, you too.
백신 접종하지 않는 젊은 층에서도 감염이 중증으로 이루어지는 경우가 최근에 늘어나고 있습니다. 백신 접종은 감염 위험을 낮출 뿐만 아니라 입원과 사망 가능성을 크게 떨어뜨리는 그런 점에서 효과는 충분합니다.
A worrying phenomenon is being witnessed across the globe. The proportion of patients in their 20s and 30s appears to be expanding. For more on this trend and its reasons, I have Professor Lee Sang from Yonsei University. Welcome back, Professor Lee.
Thank you very much.
And I also have Professor Che Gi-hong from Korea University. Good to have you with us, Professor Che.
Thank you for having me.
And joining our session virtually is Professor Kiyoshi Abe at Kwansei Gakuin University over in Japan. Pleasure to have you with us, Professor Abe.
Thank you for having me. Thank you.
Right. Professor E, we'll start here in the studio then. Let's begin with the proportion of patients in their 20s and 30s and the related concerns.
So there has been some rise in the proportion of people in their 20 and 30 among all of the confirmed cases. As for 20s, there had been 5.9 confirmed cases among 100,000, 20 people in their 20, and there had been 4.3 person per 100,000 population among those in the 30s. And But I think the reason for this rise is in the twofolds. First of all, there had been a higher level of vaccinations among those who in the age of 60s. So there had been less number of the people who had been vaccinated among in those age groups. Secondly, because of the late Delta variant, there had been just more number of the people, so that the absolute number of the those confirmed cases among 20s, 30 has been increasing.
I see. Professor Abe, I understand Japan is also noting a similar phenomenon, that is a growing number of young adult patients. Do tell us more about the situation there.
Yeah, so actually the situation is very serious at present. But however, while the government issued the first-time statement of a state of emergency in Tokyo and other prefecture, many people maybe do not optimistically believe they can handle it, because after experiencing the previous state of emergency, now everybody recognizes that even under such a situation, many people, not only younger generation, many people will move and act freely and enjoy themselves, believing they will be okay. But in reality, the number of infections per day is getting higher and higher, and we have seen the record of more than 20,000 new infections per day for a while. So the actual number of infections yesterday was 24,497. So, and according to the Statistics Bureau of Social Welfare and Public Health in Tokyo, among those who were infected during the period from August 10 to 16th, the percentage of people under 39 is 65.8. It means that younger generations are now put under the most risky condition. Contrastingly, the percentage of those who are over 65 infected is getting lower. It just thanks to the spread of vaccination among those populations.
I see. So the figures are proving the reality that young people are becoming more infected with the virus. Professor E, aside from the reality that young adults have yet to be vaccinated, as you mentioned, what else appears to be fueling infection among them?
I think because of the pandemic fatigue, it had been quite a long years since there had been quite intense social distancing. So there had been more of the activities among the young people, and they had been, even though there had been a lot of government restrictions, but there are always like some of the loophole that people are getting together. So many of the transmission had been happening not in large gathering, but in many of the small close contact in small friends gathering or family gathering. So that had been still the problem in Korea as well.
Right. Professor Che, there are some pundits who link the general perception of the pandemic within young adults to its potential spread among them. What can you tell us about this view?
Yeah, over the course of COVID-19 pandemic, we have witnessed several major group infections among young people's community in South Korea. So I believe that young people in South Korea are well aware of the high possibility of getting infected by the COVID-19. However, their perceived seriousness and susceptibility to COVID-19 infections was somewhat lower than other age groups, which would be associated with their ambivalent attitudes and behaviors towards the quarantine policy and rules.
And talking about their attitude towards the pandemic, there is talk that many of these young people claim the risk of being infected depends on fate.
Right.
Now, what impact does such a fatalistic approach to COVID-19 have on its possible spread within a community, Professor Che?
Yeah, so actually that's related with a lot of cost and benefits analysis among young people. So they believe that the COVID-19 infection has low risk for them because they are healthy enough to recover with mild symptoms. But they are really concerned about higher side effects, serious side effects of vaccination. So those kind of things are related with their attitudes towards the COVID-19 infection and the vaccination.
I see. And for the sake of comparison, Professor Abe, what is the perception towards COVID-19 among young Japanese adults?
Yeah, actually, at the beginning of the pandemic in Japan, it is often said that the younger generation is relatively safer because even if they are infected, it's quite rare for them to be in a life-threatening condition, just like in Korea. And they think only elderly people are in serious danger of being infected and dead. But now, facing the spread of the Delta variant, everything has drastically changed. Now it's clear that even the younger people are not safe at all. However, very interestingly enough for a sociologist like me, one research conducted by the medical university shows that the older the generation is, the more the people feel like they will not be infected by the COVID-19. Surely, it's fairly understandable that people over 65 are inclined to think like that because they have already taken the second jab. But it seems somehow very strange. The generation of 40s and generation of 50s are more optimistic than the younger people with the prospect of infection. I just wonder about that, but that sort of result shows not only younger, but also older generation are not so serious enough for the imminent risk of the COVID-19 in Japan.
I see. Professor Abe, do you suppose the hosting of the Summer Olympics and the ongoing Paralympics there in the country may have sent perhaps mixed signals to young adults in the country?
Yeah, of course, and surprisingly, both before and after the Olympic, the Japanese government declared that holding the game doesn't affect the spread of the infection in Tokyo, though the proof they showed was far from persuasion. I suppose many people did not believe such a political statement by the government, just legitimizing the Tokyo Olympic. In reality, it's crystal clear and visible that many people moved and gathered on the street to see and enjoy the game, even if there were no audience in the stadium. And the rise of the mobility among the larger population easily caused the risk of infection, as the medical experts have long alarmed. It's quite natural for not only younger, but also the public in general, to feel they can relax their quarantine measure, seeing such a huge festival going on in front of them in Tokyo, as if it has nothing to do with the COVID-19.
Right, sadly, of course. Now, Professor Lee, here in Korea at hospitals, like Professor Abe mentioned, the number of young COVID-19 patients in critical care is on the rise, I hear. Now, can you explain this sad reality for us?
To explain the situation a little bit more in detail, I don't think it is. I don't think it is the case of the nature of the virus is changing so that the proportion of the young people developing a serious condition is increasing, but the absolute number of the young people's confirmed cases among the young people are increasing, and that is increasing the number of the death or number of the those who are developing serious case are increasing. So, for example, for those people above age 60s, because of the high vaccination rate, the proportion of the development of the serious cases had been decreasing from 10% to less than 4%. But for those people under the age 60s, the proportion of the confirmed case developing serious symptoms had been staying at 1%, but the number of the total cases had been more than doubled, which means there will be just more cases And also with the larger number of the cases of the total daily infectious case means that even among young people, there will be some of the people who are having underlying conditions, diabetes or hypertension and or other underlying disease, so that more people, there had been more people are exposed to the danger. So even though people are in their 20s or 30s, with a larger number of the cases that are happening in Korea, we have to still be very careful and take all the preventive measure.
Right, of course. Professor Chair, also on the local front, vaccine reservations among those aged between 18 and 49 stand on the 60% level, indicating the presence of some tangible form of vaccine hesitancy. What are your thoughts on this finding?
Yeah, vaccine hesitancy might be related with several factors. First one, their kind of perception, lower risk perception about getting infected, even though they believe that higher probability of getting infected with COVID-19. That's one of the perception. And second one is that the side effects, they're really concerned about side effects of vaccinations, like myocarditis. So that perception might not kind of relate with true fact. However, some of the young people is really concerned about it. And second one, they don't have right information about what happens if they have experienced kind of a serious, rare but serious side effect. So those kind of perceptions and their kind of biases and myths might be related with the vaccine hesitancy. And also the Professor Lee said the chronic kind of fatigue and the prolonged depression and anxiety might be related with their hopelessness, lack of control over the situation. Those are all related with the vaccine hesitancy.
Right. And speaking about vaccines, Professor Abe, what can you share with us about the inoculation rates among young adults in Japan?
Yeah, so according to the Okinawa Shimpo newspaper, and Okinawa is one of the most serious place suffering the newly infection. The rate of having taken the first jab among the population under the age of 39 in Okinawa is less than 20%, and that of the second is less than 10% at the time of the mid of the August. Certainly, according to the several other research conducted by the university or research organization, it is generally shown that the younger the generation is, the more reluctant they are in taking the vaccination. But I suppose it doesn't necessarily mean that the younger people in Japan is so skeptical about and have no trust in the vaccine for COVID-19. Rather than being skeptical or suspicious of the vaccine, just like believing the weird conspiracy theory circulating in the SNS world, they were just very cautious and very anxious about having a new vaccine, worrying about the unpredictable consequences it might bring about to them.
Right. And speaking about unpredictable consequences, Professor Lee, some young people are claiming the risk of dying from COVID-19 inoculation is higher than the risk of dying from COVID-19 infection. What is the reality?
I think this is one of the some of the common notions that are spreading around that needs to be fact-checked. If we look at the data, we can see some of the facts there is otherwise. Among those people who are developing COVID-19 infections, among those confirmed cases, the rate of proportion of death had been about lately 0.02%. But among those people who are inoculated, vaccinated, the confirmed cases of the death that are confirmed to be due to the adverse events had been 0.0005% among those people in their 20s. And among those people in their 30s, the proportion of the death among the confirmed cases is about 0.03%. And the the adverse events related death among those people who are vaccinated in their 30s is 0.0011%. So, however, there is some kind of death that are happening among those people in their 20s and 30s. It is a much lower risk than developing serious symptom or death because of the COVID-19 infection. So there is saying among the infectious disease experts, which many of the experts are advising again and again, the best vaccines is the vaccine that you can you can get at the moment. So the risk of adverse events, I think, is much lower than risk of developing severe symptom or death because of the COVID-19.
Right. Well, thank you for verifying that for us. Professor Che, what do you suggest now to ease or even better eliminate anxiety over vaccines?
Yeah, just Professor Lee mentioned that information we need. So one of the most important approach is the education about the cost and benefits of vaccination and COVID-19 infections. For example, like myocarditis, which is one of the most concerning side effects among young adults, are much higher with COVID-19 infection, not vaccination. So those kind of information need to provide it. Also, the government need to make the partnership with community members, and because a lot of young people gain information from websites and trusted influencers and their friends and family members. So if we provide education within the community, like college, the church members, and family physicians, and those kind of partnership related education is highly important.
Right. Professor Abe, as part of efforts to boost inoculation among those aged 39 and younger in Japan, I hear authorities in Tokyo are poised to set up a reservation-free walk-in vaccination center within this month. What has been the response to this effort?
Yeah, according to the NHK TV news this noon, a Tokyo Metropolitan Government just opened a new walk-in COVID-19 vaccination center today at Shibuya. And even early in the morning, about 7 a.m., many young people who want to get jab made a long queue. Before the beginning at noon, the center closed a new entry, as the number of vaccination prepared was just around 300. As this case tells, the most serious problem we are now facing in Japan is that there isn't enough vaccine to deliver to each local government. Even if people would like to take a fast jab, booking a reservation for it is still sometimes very difficult. Therefore, if the government can afford the enough amount of the vaccine at a place where everybody can easily access, I guess the rate of those who will accept the vaccination will rise quickly, even among the younger generation. Therefore, I would judge that those who are mainly responsible for the present situation in Japan, where the number of the newly infected is rising, and the rate of having vaccination is relatively low in comparison to other countries, is not to young people, even though they are often regarded as being not so serious enough for the risk of COVID and very reluctant to take vaccination. But the responsible is government that have not implemented the effective measure of preventing the spread of infection and supplying enough amount of vaccine for the nation. I suspect that one of the reasons why they failed to do it is that government has been so keen to hold the Olympic game this summer, even though the situation of COVID in Japan was getting worse day by day. As a result of that, they postponed the necessary measure to take and might have missed the opportunity to make the situation not so serious as we face now.
Right. Well, vaccine procurement is an issue for a lot of the countries around the world. Professor Abe, thank you very much for your insights today. And Professor Lee here in the studio, thank you very much for your thoughts. And Professor Che, thank you for being with us today.
My pleasure. Thank you.
Right. Well, as our group of panelists have said, youth does not protect you from the pandemic. So do seek to take active part in prevention efforts. Thank you for watching. Have a safe weekend.
economic crisis stemming from the COVID-19 pandemic. Environmental issues have drawn significant attention